How to spot infection signs in infants, elderly, and immunocompromised. Imagine trying to catch a small spark before it turns into a big fire. That's what recognizing infection signs in these groups is like. Their bodies don't always show the usual signs, so you need to watch carefully. In infants, their immune systems are still growing. They don't produce as many antibodies yet, so infections can spread fast. A simple fever might be the only sign. Watch for persistent crying or fussiness, which can mean discomfort. If they seem unusually sleepy or less active, it could be a sign they're fighting something off. Poor feeding or refusing to nurse is another clue, showing they feel weak. Breathing problems like rapid or labored breaths are serious signs. Sometimes, you might see a rash, vomiting, or diarrhea depending on what's causing the infection. Because infants relying on antibodies from their mothers and breastfeeding, their own immune responses take time to develop. That's why early detection is so important. For the elderly, aging naturally weakens the immune system, making infections harder to spot. They might not develop a fever even when seriously ill. Instead, look for confusion, sudden mental changes, or delirium. These are common signs of infections like urinary tract or lung infections in older adults. Fatigue, weakness, or a sudden drop in mobility can also be signs. Loss of appetite and dehydration are common when they are unwell. Cough, shortness of breath, or chest pain should be taken seriously. Because their immune responses are slower and less obvious, infections can become worse quickly without clear symptoms. Regular monitoring and prompt medical attention are key. People with weakened immune systems, like those with HIV, cancer treatments, or organ transplants, face even more challenges. Their infection signs might be subtle or different from what you expect. Fever remains a main sign but might be the only symptom initially. They may have localized pain, swelling, or redness that's less obvious due to reduced inflammation. Fatigue or feeling very unwell can be more intense. Because their immune defenses are impaired, infections can spread fast and cause serious complications. Even mild symptoms should prompt a visit to the doctor. Early treatment can prevent severe outcomes. Monitoring these groups involves paying close attention to small changes. Watch for behavior shifts, feeding issues, breathing difficulties, or mental status changes. Good hygiene, vaccinations, and avoiding exposure to germs help protect them. If you notice any signs of infection, seek medical advice quickly. These groups don't always show typical symptoms, so staying alert can save lives. Recognizing early signs and acting fast makes a big difference in their recovery.